Crop Growers offers all types of policies, including basic yield policies that provide coverage based on harvested yield per acre, and revenue policies with both upside and downside price protection. Cost depends on the crop, policy, and your location. That's why our crop insurance agents help you price out the best options and coverage level for your business. Crop Growers through Farm Credit is here to help you weather your financial ups and downs, no matter what crops up. Learn more at cropgrowers.com.
Okay, we will get started. Good afternoon, everybody. I am Lindsay Ferlito. I'm one of the 2 regional dairy specialists with Cornell Cooperative Extension. And I'm joined today with my coworker, Casey Havicus, and we will be moderating today. To share Pete's presentation now. So our first speaker is local, Dr. Pete Ostrum. For those of you joining us from Northern New York, I'm sure you know him or have heard him speak before. Pete is a vet with Countryside Vet Clinic, as well as a partner with DHMS here locally. And he's going to be talking to us about selective dry cow therapy.
There we go. Good. Okay. Very good. Thank you, Lindsay. Okay, I'm Pete Ostrum, and I've been involved with select dry cow therapy for a number of years. I was involved with the actual trial that we did that we're going to talk about a little bit later on, about 3 years ago. And more recently, I've been involved with the New York State Farm Viability Institute. In that, DHMS, Cornell University, Countryside Vet Clinic, we partnered with the New York State Farm Viability Institute to enroll farms in select dry cow therapy program starting January of last year. Next slide, Lindsay. So my first question for all of you, how many of you have ever heard of select dry cow therapy? Yes or no? So we need to, that's our first poll question. Excellent. So most of you, roughly 2/3 of you, have heard of this new protocol. So that's great. And the other third of you, hopefully you'll learn something today. So next slide, please. Let's see if we can just, there we can get. So exactly what is this program? Okay, so standard practice has been to treat all cows that dry off with an antibiotic, plus or minus using an internal teat sealant. But more recently, research has shown that udder health and cow performance may be maintained without treating every single dry cow with an antibiotic. And over the past 10 years, select dry cow therapy has really continued to gain acceptance within the dairy industry in the United States. Next slide. So our primary objectives of this protocol is to decrease the overall use and cost of dry cow antibiotics by selecting a specific subset of cows to receive intramammary treatment. The new protocol has reduced antibiotic usage anywhere from 40 to 60% in many herds. Secondly, we want to identify two groups of cows that dry off by using a simple algorithm available now through Dairy Comp 305. And the algorithm uses somatic cell count data and clinical mastitis events to determine which subset the cow belongs in. Subset 1 would be cows eligible for antibiotics and an internal teat sealant, or that subset of cows that are eligible only for an internal teat sealant, no antibiotics. Next slide. And finally, we're going to continue to advocate for antimicrobial stewardship on dairy farms. Veterinarians need to have oversight of antibiotic usage on dairy farms. And by this, I mean, we as veterinarians need to be involved with the use of antibiotics in treating disease. And finally, we need to continue to utilize best management practices by judiciously selecting the use of antimicrobials on dairies. If antibiotics are indeed necessary, we need to make sure that the right animals are treated at the right time with the right antibiotic with the right dosage. Next slide. Our second poll question: are you currently using select dry cow therapy in your dairy herd? Yes or no? Great. So about a quarter of the herds that are represented today are using this, and about 75%, 74% are not. And that pretty much mirrors, that's a little bit higher than the national average. Right now, about 10% of herds in the US are using this new protocol. So there's lots of room for improvement. Again, many of you, we may have more opportunity as the word gets out. Hordes Dairyman did a nice review of the research that we'll be covering today. Next slide. Another poll question: if you have tried and have discontinued select dry cow therapy, why did you stop? Too time consuming, didn't work, you didn't know which cows to treat or not to treat, all or some of the above. Okay, excellent. So a variety of reasons why people have stopped using this, and hopefully we'll be able to kind of tease this out in our questions. So that there's lots of reasons why select dry cow therapy may not work on your dairy. Next slide. So now I would like to explain the actual research trial that we were involved with approximately 3 years ago that really provides a scientific basis for select dry cow therapy and the different options that exist. And I'll be using the slide set prepared by Sam Rowe from the University of Minnesota. Next slide. And this project research trial was funded by USDA, NIFA, that's the National Institute of Food and Agriculture, Zoetis, and the various fieldwork teams. And this is important. They were not farm workers, okay? They weren't herdsmen. These were not people working on the dairy. These were people hired to collect data from the various research teams. Next slide. So this is important. Mastitis is a big deal with dairy cattle, as you all are aware of. It affects cow health, production, animal welfare, farm economics. Mastitis is expensive to treat, and it affects food quality and food safety. Next slide. And recently, there's been lots of discussion in the veterinary profession and the medical profession about antibiotic resistance. And one of the areas that we can comment on in animal agriculture, there may be unnecessary antibiotics used. And is this an opportunity? Could we look at dry cow therapy as an opportunity to decrease the overall use of antibiotics on dairy farms? Next slide. So dry cow therapy, that's the topic of today. Next slide. So traditionally, and this has been a cornerstone, a hallmark of quality milk for a number of years, 40, probably even 50 years, blanket dry cow therapy. And that's used in approximately 80% of farms in the US. So with select dry cow, or excuse me, with blanket dry cow, we're going to treat the infected and the uninfected quarters. Next slide. So all cows are treated, all quarters. Next slide. And the next slide. Versus select dry cow therapy, and this is again used on 10% of the farms. Again, in our group, 25% of our participants are using this. We're only going to treat the infected quarters. The benefits being we're going to have reduced antibiotic usage and lower drug costs. Next slide. And next slide. So research has been done in the US for about 10 years. In the majority of research trials, it's been beneficial to use selective dry cow. 2 trials were basically so-so, unequivocal, and 2 trials actually showed that select dry cow therapy was not beneficial. And there may be reasons. There are obviously reasons for that, and we can discuss them a little bit later. As you'll see in some of our herds, it wasn't perfect for every single herd. Next slide. So the objectives of this trial, we're going to compare 2 select dry cow therapy programs to blanket dry cow therapy. And we're going to look at the results we're interested in looking at: antibiotic usage at dry off, the intramammary infection dynamics during the dry period, and we're going to follow these cows out for the first 4 months of their lactation. For 120 days, we're going to look at their health and their productivity and compare. So we're looking at our control group, which is basically our blanket dry cow therapy, and then the 2 new groups, we're going to look at a culture-based group and a group that's going to be using an algorithm. Next slide. So this study type, and we started this trial in the summer of 2018. It was a randomized controlled trial. Randomized meaning that all the groups were similar for lactation number, milk production, and group size. And it was controlled, meaning our control group was our blanket therapy group. Roughly just over 1,200 cows, 7 herds from 4 sites. So California, the upper Midwest, and New York. Next slide. And you can see that there was various management styles in these herds. They were relatively large herds, ranging anywhere from 850 cows all the way up to just under 6,000 cow herds. Bulk tank somatic score, looking at that, you would say they're pretty well managed. You know, bulk tank scores are pretty low, anywhere from 9. Okay. Sorry guys, just said my internet connection was unstable, and then so let's blame it on COVID, okay?
Do you want me to go back to the other slide, Pete, or is this one
Sure.
good?
Yeah, I think, no, you're fine. You're fine right there. Okay, so this is our study design. We have 3 groups: the blanket dry cow group, roughly just over 400 cows; the culture guided selective dry cow group, okay, 432, and the algorithm guided selective group. Next slide. So in the blanket, that's traditionally how we dry cows off. Every cow is going to get treated in every quarter with an antibiotic and an internal teat sealant. Next slide. culture guided, okay? We're gonna culture every single cow at dry off at the quarter level, and we're only gonna treat the quarters that are positive, that have an intramammary infection. And we're gonna treat those with antibiotics and an internal teat sealant. If that quarter cultured negative, she only gets internal teat sealant. Next slide. And this is just showing you the quarter level, how we cultured at the quarter level to decide whether or not she needed treating. And the next slide. And in the algorithm guided group, again, if any cow meets the criteria, she's going to get antibiotic and an internal teat sealant. And if the cow does not meet the criteria, only internal teat sealant. Next slide. So the treatment criteria that were utilized for this study, any cow that has a cell count over 200,000 at any test during her previous lactation will be treated. Likewise, any cow that has had a clinical mastitis case in the last 14 days, so right before you dry her off, if she's popped up with mastitis, she's going to get treated. And also, if a cow has any recorded mastitis event, 2 or more during her lactation, she's going to be treated. Next slide. And this is how the list would pop up on Dairy Comp, the cow number or her name, and a simple yes or no, whether or not she needs antibiotic treatment. Next slide. All cows were subjected to a dry period, 30 to 90 days. Next slide. And just to make sure we weren't missing any cows, every cow was cultured at dry off and again at calving. Next slide. And then we followed these cows out for 120 days in milk. Next slide. So let's look at our results. So antibiotic usage was reduced by 55% in the 2 treatment groups, that being the culture group or the algorithm group, versus blanket, where 100% of the cows were treated. So antibiotic usage reduced by 55%. That's huge. Next slide. And then looking at the internal intramammary infection dynamics. So the cure risk for these animals, and these were animals that were infected at dry off, but were successfully cured during the dry period. And they're equal. There's really no change between the 3 groups. So that's great news. Next slide, please. New intramammary infection. So these cows were clean at dry off in the quarter, yet they cultured positive when they freshened. And again, there's no change in the 3 groups. Again, that's really good news. And the next slide. And this is looking at all cows across the board if they had any intramammary infection at calving. And again, all 3 groups are identical. Next slide. Now, let's follow these cows out for 120 days. Clinical mastitis was identical, virtually. Blanket at 14.5%, culture group 12.5%, and the algorithm group 12.1%. So really no change in whether or not these cows had a clinical mastitis event the first 4 months of their lactation. And then removal from the herd, again, really no difference in removal from the herd, be it culling or death. And the next slide. And again, looking at somatic cell count for the first 4 months, again, really no difference in cell count. Didn't matter which group she was in, cell count was basically the same. And again, the treatment group, again, blanket, culture, or the algorithm really made no difference in milk yield. Next slide. So let's look at this study. So the strengths of this study, we had a large sample set of cows in a variety of herds. It was implemented on commercial dairy farms from multiple regions of the US, and the lab methods we used were the best methods available. The limitations of the trial were that the protocols were implemented by study personnel. Remember that picture, the folks that were actually collecting data? They were not farm staff, okay? They were people specifically trained for this trial, okay? So it may change a little bit if we have farm staff actually doing the different either blanket treatment or the algorithm guided treatment or culturing. Okay, so we may not be able to generalize. We had good results with this trial, but does that still apply to herds that are poorly managed? Next slide. So further research probably does need to be done. We need to make sure that we're actually screening, we're using the right tools for screening. What is the economic impact of not treating cows with mastitis? And does it affect the microbiome? Meaning that there's a normal group of bacteria that are in milk, and by not treating cows with antibiotics, how is that going to change over time? And then can we replicate this particular study with producer implemented programs? Meaning this is going to be handled by people on the farm, you know, doing the different programs and hopefully using the algorithm. And do we need to further have further refinement of the algorithm to make sure that we're selecting for the right cows? It appears with this trial that the gold standard was culturing every single quarter at dry off, and the algorithm properly identified those cows that needed to be treated. Next slide. So another poll question, do you routinely use antibiotics at dry off? Great, and this would probably mirror a previous question if you're using select dry cow, and a quarter of you are, so that would make sense. And next slide. And how many of you use teat sealant at dry off? Excellent. So it appears that most people are using internal teat sealant. And next slide. Another poll question, do you routinely culture your clinical mastitis cases? So this is interesting. So so Paul Verkler and I at QMBS, maybe we have more work to do. So that's probably another topic, and maybe Pam will touch on this a little bit later, but it's probably something we should be doing, no doubt. And next question. And do you have access to individual somatic cell count data? This is important when we're using the algorithm. Okay, so it appears that most people do have access, so that's good. Although the algorithm can still, possibly still be used, but somatic cell count data is really very important for using the algorithm. And next question. So according to the University of Minnesota, I think this is a really nice summary slide, because what herds have the best chance of having success? And these, you kind of need to go through this with your herd and your veterinarian, your herdsman, and just kind of check off the boxes. So it really is helpful if you have a bulk tank score of less than 250,000. Contagious mastitis pathogens are under control. So low numbers or zero numbers of Staph aureus. We used to say strep ag too, but there's hardly any strep ag herds out there. But contagious mastitis pathogens have to be under control. And use of an internal teat sealant in all quarters at dry off is a really good idea, as long as, and read number 4, you have the correct technique for intramammary infusions at dry off. Okay, we'll talk about this a little bit more. Okay, and you need well-trained personnel to make the correct screening and treatment decisions, and you need the ability to monitor the program to verify if it's working well. Next slide. So currently with New York Farm Viability, we have about 22 herds that have signed up, and with DHMS and Countryside's help. And just to give you kind of a snapshot of 4 different herds. Farm number 1 currently milking about 750 cows and have a cell count right now of 130,000. And they are only, since they've been using the algorithm guided treatment program, they're only treating 45% of their dry cows with just in tubes, antibiotic dry off tubes. That equates to about $5,000 per year. Farm number 2, a smaller herd, 150,000 bulk tank sample right now, and they're only treating 40%. So 60% of their dry cows are not being treated. Both Farm 1 and Farm 2 are using an internal teat sealant, okay? Regardless of whether or not they get antibiotics, but they are meticulous about their technique. So farm number 4, for 4 months, we had no problem at all using Select Dry. Then June and July hit, okay, and we had 10 dead cows. We cultured Enterobacter, which is a kind of a nasty gram-negative, or it can be, but it really came down to poor infusion technique, and we discontinued the Select Dry Cow treatment program for a period of about 2 months. We retrained everybody, and then we started again up in October with no further issues. So again, this is a herd that had poor technique because we were infusing, they were on internal teat sealant with no antibiotic, and they were actually, because of their poor technique, we were actually inoculating cows, infecting cows with Enterobacter at dry off, which is obviously counterproductive. Next slide. So how do you monitor if the program is working? So you need to continue to do regular bulk tank cultures to screen for contagious pathogens, routine somatic cell count testing, and I really advocate routine culture of clinical and chronic mastitis cases. We need to monitor clinical mastitis and somatic cell count data in early lactation, and it really is helpful to have veterinary involvement to evaluate your records going forward. Next slide. So my final thoughts are, after being involved with this for about 3 years, Select Dry Cow therapy definitely has the ability to significantly decrease the use and cost of antibiotics on dairy farms. However, the program is not for every farm. You need proper infusion technique, and cow cleanliness is key. Milk quality and cow health can be maintained without blanket dry cow treatment, and veterinary involvement and record evaluation improves the likelihood of success. So this is not a program that you can set up and walk away from. You need to keep monitoring. And next slide. And I think with that, we will save our questions for our roundtable discussion. So thank you.
Great. Thank you very much, Pete. So our next speaker is Dr. Paula Ospina. Paula used to work with Cooperative Extension or with Cornell, with QMPS.
Yep.
And she is now an independent consultant. She's a veterinarian and she also speaks Spanish, so very helpful to have for dairy producers in the area. So Paula's going to be talking to us about bedding and milk quality. So you should be good to go, Paula.
Yep, and you're seeing the video version of the PowerPoint?
Yes, it looks good, I believe.
All right, and then as far as timing, shoot for ending at, we're starting at 12.
Shoot for ending at 10 after?
Okay, perfect, cool. All right, well, thank you everybody for being here. It's really, I've done a lot of Zoom presentations, but it's still weird. So bear with me because I'm talking to a screen in a room by myself. But today we're going to be talking about bedding and milk quality. I just want to take a moment to just give credit where credit is due. Dr. Valeria Alanis, which is working on her PhD, has done a bulk of the work that I will be presenting to you guys here today. So just wanted to make sure, she is definitely getting the credit where credit is due. And just a little bit of background about myself. I'm a veterinarian and focused on milk quality as far as my, consulting. I do have a PhD from Cornell in epidemiology. I worked with Quality Milk until last year, currently consulting and bilingual. So do a lot of on-farm training, milker training, specifically focused on milk quality. So that's been kind of what I've been doing since QMPS, is working with different veterinary practices and other groups to just focus on that part of the whole productive system. And so wanted to take a few slides to just get to know a little bit about you guys. So here's the first question of my poll. And I don't know if I will see the poll will show up on my screen, I hope. Okay, yes, there it is. So just want to get a little bit of a sense of who's out there in the audience, just to get an idea. So we have producers from all different sizes here, which is awesome. I'm just making a little note to myself here about where we are. So the next slide is another poll question, I think, if I can click on it. Okay, so this is another one about bedding type. So we learned a little bit about what size herds we're looking at, and then I just want to know what's your predominant bedding type. All right, so we see lots of sand, lots of sawdust, some manure solids, and other, but primarily sand and sawdust. Okay, that'll be interesting to go through. Excellent. And 50%. 5%. Okay, then my next slide. So one last question, I think. How do you feel about your current level of milk quality? There's lots of ways to measure milk quality, right? But if we just think about somatic cell, just so that we're all answering the same question. And I didn't want to ask where your bulk tank somatic cell count was. I just kind of want to know how you feel about it. Okay. So there's always a chance to improve. I think that's the majority. I think most of us will say that, unless you're down in the 100. But excellent. Good. All right. So there's always opportunities for improvement, but I'm glad to see that some of you are feeling really good about where you are with your cell count. And then obviously for those of you that need help to improve, hopefully some of the stuff that we're looking through in these presentations will give you some of those tools to do that. And, anything we learn, I think, is always helpful. So hopefully we'll get through some of the information there. Great. All right. So I'm going to move to the next slide. All right. So the big question that has been, as I've worked through milk quality at QMPS and so forth, we get the benefit of working with farms that are doing a lot of cultures for clinical mastitis, subclinical mastitis, and so forth. So with these farms, we have a lot of information as to what's going on with their farm, and we can target our focus and management and treatments and so forth to help improve milk quality. Both clinical mastitis, reducing clinical mastitis cases, and therefore hopefully reducing somatic cell counts and so forth. But one of the things that we found, and not just us, but throughout the literature, you'll find that we're seeing more and more causes of clinical mastitis being associated with environmental pathogens versus contagious pathogens. And that's great because contagious pathogens, we usually blame the transfer of contagious pathogens in the parlor, maybe poor milking routines, et cetera. And if we're able to reduce those numbers, that means that we're doing a better job in the parlor. We're also just reducing the number of cows that have these contagious pathogens, which is also really good. But now we're looking at these environmental pathogens and wondering where they're coming from, how they got there, and how we can help reduce the numbers of pathogens in the environment. Does that make sense? Of pathogens getting into the cow, that probably makes a big difference. Where are they coming from and how can we do this? So one of the biggest environmental things in a cow's life is her bedding, right? She should spend half the day, if not a little bit more, by hours, right, laying down in this bedding. So we want to make sure that the bedding is clean, comfortable, helps keep her clean. And so lots of times we ask, does the bedding affect milk quality? How is it related? And can I improve milk quality based on my bedding choices? When we talk to producers and when we did this research project that I'll be introducing here in a couple slides, that was one of our questions about, how they felt about their bedding, why they made their bedding choices and so forth. And a lot of times the bedding choices are made because of milk quality. A lot of times bedding choices are made because of the limitations of manure management systems, et cetera. But if you ask the producer, they would say, well, if I could choose anything, I would choose X bedding because I think it will do better with my milk quality. So milk quality definitely is associated with our bedding choices, and obviously limitations within our manure management system kind of dictate what we end up doing. Before we get into the research project that I'm going to present today, I just want to take a couple steps to just talk about sampling bedding, because that is also one of the other big things that we go through is when I was at QMPS, or just even working with this project, or just generally working with producers. And one of the things is how to sample bedding. We've all, I think, now have it down how to sample milk, how to sample bulk tanks, more or less. But then sampling bedding gets a little bit tricky. And one of the reasons it gets a little bit tricky is that there's lots of variables as to when and how much, et cetera, to collect bedding. I don't know that I know the right answer to this, but I can tell you that as long as you're consistent, that's better than not being consistent. So that's usually my, my go-to, like, well, I may not know the right answer, but I know this is the wrong answer. So sampling, if you are going to sample bedding on your farm, you want to do it consistently, because if you're going to be comparing samples from month to month, week to week, batches, et cetera, you have to do it the same way, because you're going to introduce a lot more variability if you're sampling in different ways. There's already a lot of variability in bedding, and I'll show you some of those graphs that we collected from our very strict sampling protocol with the same person going at the same time, et cetera. And we still had lots of variability in bedding. So if you're not following a protocol, guidelines, timelines, the data that you get, it may be hard to interpret. So we really want to have you do it the same way every time. And then also, as we go through, we also realized that gathering other information was also important. So bedding values and the number of bacteria in bedding, and again, I'll show you this data in a few minutes, can be so variable that you have to put it in perspective. So we wanted to not only know how much bacteria was in the bedding, which is something objective that we can send to the lab and get a number, but also other objective measures of how stalls were being used and how cows were using these stalls and so forth. We weren't able to, in this study, get to the point of checking udder hygiene and so forth, which would have been helpful, I think, to put this whole piece together. So I definitely recommend that when you do bedding samples, you not only follow consistent sampling protocol, but you also consider the other factors that go along with this, right? So how many stalls are available, usable, et cetera. We've all been to farms where you may have 100 stalls in a pen, but 20 of them are broken and beyond repair. So, really you have 80 stalls and so forth. So we wanted to know how the stalls were getting cleaned routinely. This is part of the information that we collected for our research. And then we also noted the type of bedding and bedding management. And by bedding management, we were talking about some people are applying lime to the end of stalls. Some people are mixing in lime, like with manure solids, before they apply it. Other people are not using lime at all. Most people are scraping the back end of the stalls and then pulling bedding from the front of the stall back. Some farms had not enough bedding ever to do any of those things. So, that was also something that was noteworthy. So first, notice what is happening, write down this information. Next, we want you to evaluate all the function of stalls, which we talked about before. Then we also thought it was important to evaluate stall cleanliness. And really, in our research, we got really fancy and had like 5 levels of cleanliness, and then realized in the real world that that's not, we either want it dirty or clean, because that's really what we got to the bottom of when we started looking through the data. So one is mostly completely clean, no manure, no urine, just looks used. So here in the picture on the left, for example, looks like a just used stall, and on the right, it looks like a dirty stall. So this would be, if I was evaluating these two stalls, I would have a clean one and I would have a dirty one. And what that tells us is if the majority of the stalls are dirty, we want to think about cow positioning, looking at measurements, et cetera, because again, I can collect a sample of bedding and get some number for bacteria, but I think that the biggest problem is how these cows are using these stalls, right? And so getting that bedding bacteria number may not solve our problem, may not focus us on the right question and therefore solution. So maybe by the end of the presentation or by now, you're starting to gather a little bit that I'm going to kind of push down a little bit the value of the exact number that we get for bedding bacteria and have you focus more on how bedding is used, how stalls are used, how clean cows are, because I think that those are bigger factors than that number that we get. But I know everybody wants to have a number, so we'll get to those in a few slides. The next thing is looking at bedding quantity. And again, we started off with a bunch of different levels of like enough bedding, not enough bedding, medium amount of bedding, et cetera. And we decided that really it made sense to just say there was enough bedding or there wasn't, really have a strict cut point on that. So adequate bedding for deep beds, for example, minimal curb exposure. It looks like there's enough bedding. And in this picture for step 4, it looks like the left side there would not have enough bedding and the right side would. Step 5 looks at it for mattresses. And what we're looking for here are bare spots on the mattress. Obviously the bedding on top of a mattress is never going to be as much bedding as deep beds because they're filled with bedding. But you can see here on this by step 5, on the left, we don't have enough bedding, and on the right, it would be a stall that I would consider to have enough bedding. And we put this information with our data. And for you, if you're looking at your bedding, I want you to be critical about how your farm is performing, or if you're a veterinarian, or if you're an extension person going out to farms. A lot of people want to send all kinds of bedding samples to us. And I say, okay, well, is there enough bedding in the stalls? That's question number 1. Are the stalls clean? That's question, number 2, or 1 and 1A, because those are very important factors in how bedding and cow and bacteria go together. Then we want to let the regular stall maintenance happen. So, like I said, a lot of farms will go through and clean the back end of the stalls. We want that to happen because the bedding sample that we want to collect, we want it to be representative of what the cow is going to see when she comes back from the parlor, right? Because if the question is the bedding affecting milk quality? Is the bedding causing problems? Obviously, the bedding before this happens, will have manure and other things in there, and that will increase our bacteria count. But I think ultimately the question we want to ask is, how is this bedding associated with milk quality? And we suspect that when she comes back from the parlor, her teat ends are still a little open, et cetera, and whatever she's coming in contact with the bedding, will be more representative of what she sees. Obviously, right before milking, also her teat ends, some cows, will be open and there will be some association there, but we had to make a decision, and this made more sense to us. So again, whatever you do, just be consistent with it. And this is what we did, and we try to be consistent with it. Then we wanted to sample about 3 to 5 representative stalls. And we wanted to have a new bag for each sample. And we did want you to sample 3 to 5 stalls and submit 3 to 5 samples. Now, I know that sounds like I'm working for QMPS and want you to submit more bedding samples, but I don't work for QMPS anymore. And I'm still telling you to sample 3 to 5 stalls and send them separately. And the reason for that, and again, I'll show you the data in a few minutes, is that there's so much variability in the results that we get. So if you have one sample, you have one set of results, and it may not give you the whole picture. So we want you to sample from the back of the stall, about 2-foot section where the udder would touch the stall. We don't want you to walk behind the vehicle driving. Be careful, there's machinery, when you're down in the stalls at the wrong time, which is when new bedding is being applied, stalls are getting clean, alleys are getting scraped. You want to be mindful of your surroundings and don't get run over by a tractor. So we thought that this was a public safety announcement worthy of including. But when you do then collect new bedding, there's 2 ways to do it. One is to go out to the pile where the new bedding is somewhere and grab a sample. And the other is to have whatever mechanism is used to distribute bedding throughout the pen and collect a representative sample from what is being dumped on the stalls. Again, I don't know what the right answer is, but I can tell you what we did. And again, we try to do it in a consistent fashion. Excuse me. So we had whatever mechanism was used to apply new bedding, dump extra bedding in 3 to 5 stalls spread out throughout the pen so that we could go to the top of that pile and just grab a sample from the top of the pile and stick it in a bag. In this one, I did say your 5 samples, just mix it into one bag and submit that, because hopefully what's in that, skid steer, or feed wagon or whatever you're using to, dump the extra bedding, the new bedding, will be mixed, and you'll get a hopefully very representative sample, and hopefully, your pile from stall 1, 2, and 5, won't be very different because they should be all very well mixed. I have had samples where people didn't do this and grabbed old bedding into their new bedding bag, and we had the sand herd with very high bacteria counts in their fresh bedding, and I was like, this is fresh sand, this should not happen. And it had to do with the sampling technique. So just be mindful of that. Obviously, the other option is to go to the pile of sand or, sawdust or whatever in the building and collect from there. My concern is, just like if you were sampling silage or what have you, if you went to the feed bunk and just grabbed a handful from the face, which again, you shouldn't do because it's dangerous. Is that representative of what's in there? Or does it make more sense if you're doing like a TMR audit to get it from the feed bunk as it's been already mixed and you're getting a more representative sample there? So that was our idea behind this, and this is why we did it. Again, whatever you decide to do, just be consistent with it. So lastly, they're dumping and you can grab from the tops. Don't do this with the bag, but the idea was that you're getting that sample as, fresh coming off this truck, and you're just going to, just have it spread out throughout the pen so you get really deep into that pile. And then make sure you label everything and get it cold, because bacteria continues to grow. You can freeze it and it can be frozen. We did some internal research a month and we didn't see changes in bacteria counts. So it doesn't mean you have to run with it, but we do want it cold or frozen. If you can't get it to the lab that same day, cold, freeze it and then get it to the lab. And then if you are sending bedding samples, if you are in New York and sending them off to QMPS, just make sure you coordinate with the lab. It does take a lot of plates to run bedding. So let them know they're coming so that they can be prepared with the materials that they need. And then for us, we did a farm survey because again, this was our research, but we wanted to, to just make sure that we got as much information as we could to learn more about the farm. There are a couple additional tests that for sand, if you're using sand, and it sounded like a lot of you are. So in addition to looking at bacteria counts, especially if you're using recycled sand, total organic matter is something that can be evaluated, and then particle size. This is more and more important for recycled sand, where you start losing some of your sand settling and so forth. So you want to make sure that you are within the parameters as you recycle your sand, and you're not losing the very small particles and ending up with big rocks, or starting with big rocks and then not having the comfort in the absorption particle or method that the sand would normally do. Okay, so I spent a lot of time telling you how to sample bedding. I'm going to move through the research results kind of quickly, but you guys will have access to these slides. And if you have any questions, feel free to email me. But basically, the background and the reason why we did this, right? Mastitis is a big deal. Cows with mastitis are more likely to get cold. They're more likely to get antibiotics. Cows with mastitis usually make more milk, a lot of times more milk than the other ones until they get mastitis. We're seeing more environmental pathogens than contagious pathogens when we look at the clinical cultures from clinical mastitis. And then research on bedding, we've been doing lots of research, lots of different groups have been doing research. We're not seeing necessarily a direct connection. Some papers have some connection. Some papers have shown like a bacteria count above which milk quality may be affected and so forth. But basically there's a lot of variability in the data that we're seeing. So our objectives were to evaluate the pathogens in bedding and focus on that controlled sampling procedure. And then based on that information, evaluate if there was an association between bedding pathogens and milk quality. And our milk quality question was just somatic cells. So we didn't do bacteria counts. We didn't do, quarter level somatic cells or anything like that. We just did bulk tank somatic cell. So we followed 5 farms for 1 year from 2018 to 2019. And by we, I mean Valeria. I reminded you again that she did all the work. We had 5 different bedding types: sand, recycled sand, straw, manure solids, and paper, fiber, or pulp. We sampled once a month and we came the day that new bedding was due to be applied. So we would grab the bedding as described previously and then the new bedding sample, and we also grabbed a bulk tank sample. This project was funded by the New York Farm Viability Institute, so we're very thankful that they were able to give us the funds to look through all of this, all of these bedding samples. And then, you know, while we were there, like I mentioned before, we looked at cow positioning, stock cleanliness, bedding quantity. We grabbed our bulk tank sample, which is measured as a CFU per ml, and our bedding bacteria counts, which are measured CFU per gram. And I just want to make mention of these units because if you are really into looking at bedding research and understanding the differences and so forth, at Cornell, in our lab, we sample and report CFU per gram, but other laboratories that are doing bedding samples are doing it by ml. So our numbers aren't always comparable. So when you're looking at bacteria counts and you're looking at research from other places, just be mindful of the units because our numbers may not be the same. This is a very hard to read table, but I just want to highlight that we had our 5 herds. Their somatic cell range, you know, from the hundreds to the 200s. And then our cow positioning or cow positioning, stock cleanliness, and bedding quantity range from 25 to 80% for cow positioning as far as appropriate, 15 to 20%. So cleanliness, you know, wasn't great on any farm. And then our quantity ranged from 50 to 90%. The paper fiber herd being the one with the least, everybody else doing, you know, quite a bit better. The other thing that's important to note on this chart is the bedding quantity, right? So I'm going to report to you bacteria counts on bedding, but I want you to think, okay, well, the manure solids herd is bedding daily. So when I come in and I sample that herd on Wednesday, this is bedding that has been there since Tuesday. And so the bacteria counts that I'm looking at have been there in that manure, those manure solids for a day. The paper fiber herd was bedding twice a week. So I got there on a day that they were due to apply new bedding. So it had been anywhere between 3 to 4 days, you know, depending on which one it was since new bedding was applied. Our straw herd was also bedding daily. Our recycled sand and our new sand was also bedding. They were both bedding weekly. So again, when I sample them on Thursday, because that's their bedding day, that sand, the used sand has been there for a week. So when we compare bacteria, just keep that in mind that some of this bedding has been sitting there for a week and some of this bedding has been sitting there for a day. The next few things, few slides are going to be graphs. And the first graph I'm going to show you is fresh, used and fresh bedding samples with detectable organisms of mastitis importance. So again, these were sampled over a year from 5 farms, et cetera, et cetera. This graph shows us that in used samples, I want you to focus down here. I have a little bar animation here to remind me. In used samples, our pink here is manure solids. 54.5% of the samples had E. coli. But that means that this whole bunch here, right, 55 did not have, they were negative. So this is why when I said before 3 to 5 samples is better than 1 mixed sample, is that if you happen to have that one sample that comes in, and remember, you send in your bag, what happens in the lab is the lab mixes your bag, gets a sample from there, and then takes a very small little smaller sample from there. So if they happen to just grab the very small amount of manure solids that doesn't have any E. coli, you will get negative. And that for me was like shocking to have a used manure sample that had no E. coli. Everybody had Klebsiella, you know, for manure solids. So at least that's one thing. But not everybody in the used sample herd, you know, here we have recycled sand. 80% of them would have had Klebsiella, but 20% would not have had it. Some of the less common pathogens, Pseudomonas, Serratia, yeast, you know, we saw some in the fresh samples, some here in the used samples. Yeast, we only saw it in sand, and very small samples were positive for that. So, you know, I wouldn't be surprised, and I would be actually happy, right, not to see any E. coli in our fresh samples. But even then, our manure solids had it, and even our recycled sand had it there. So this graph by itself, I think, to me says I need to turn in more than 1 sample to make sure that I get a representative of what's going on in my stalls. These are the average bacteria counts in fresh and used bedding. So this is the graph that everybody wants to look at to see how much bacteria is there. it's not necessarily answering how much is good or how much is bad. It's just saying, this is how much bacteria we had in these samples on these farms. And then the thing I want you to note is that this is bacteria counts log 10. So that means these numbers, unless you go and do the math, don't mean a whole bunch as far as what you get from your lab, because your lab is going to report in real numbers. They're not going to be in log numbers. At the end of this presentation, I have these graphs with the real numbers. The problem is that when we have the real numbers, the graphs get really smushed and distorted. So they're really hard to see the relationships between the beddings, which is what we want to, which is what I wanted you to see here, the relationship here. So regardless of what the numbers are, I just wanted you to see, for example, that manure solids and fresh had a lot of streptococcus and in use, they also had the same, not very different from paper fiber in the used samples, but different in the fresh samples and so forth. Sand, recycled sand and sand were different here for the streps and so forth. So these letters, if they have the same letter, that means that they were not statistically different from each other. So here for coliforms and used samples, not a big difference between manure solids and straw, because these both have A. So just wanting you to see the relationship, and obviously lots of information in just this one graph. And, you know, we don't have the time to go into all of these relationships, but you can go back and look at this, you know, on your own time. And if you need to talk about it, please send me an email and so forth. These other graphs are the variation of bacteria in used bedding. So just want you to see, this is our samples are 1 through 12. So we went to each farm, you know, 12 times because we did this over a year. Again, hard to see, but I can give this to you in a bigger format. But the manure solids, paper fiber, each have their own color codes here. And you can see, for example, for coliforms, there's lots of variation when you see this big wide box plot, which tells you some of the samples had very small numbers and some of the samples have very large numbers. And again, this is a log base 10. This is dry matter and pH. So again, the big thing here is looking at fresh samples and used samples for dry matter, fresh samples and used samples for pH. Sand is a lot drier, both the recycled and new sand compared to all of your other bedding. And pH, straw was a little bit more acidic, but overall not too big of a difference there. Bacteria count versus dry matter. Dry bedding means less bacteria in fresh bedding samples. So, you know, if we can imagine that there's kind of a downward relationship here as we go, more dry matter, less bacteria. And then same thing with the used bedding sample, we kind of see a little bit better picture of that. As it gets drier, it seems to be lower, but, you know, not clear, you know, it's not a straight line, but we do see that kind of relationship. These are the bacteria in our bulk tanks. Not really a lot of differences between the different bedding types. So we look at strep, we look at staph, we look at coliforms, we look at total bacteria count across the different bedding types. And really you see that the letters are the same, AAA, you know, and so forth. So really not a lot of difference in bacteria in the bulk tanks. We did have some bulk tanks that did not have, for example, E. coli. We had a lot of bulk tanks that did not have Kleb, Pseudomonas, etc. So, you know, having a low E. coli count in most of the herds, except for this recycled sand, you know, makes me concerned. Like, was there something else going on in this herd that made this so high? It may be not associated with bedding. Somatic cell and bedding type. So again, our question was, is there a relationship between milk quality and bedding type? We really didn't see a difference between the different farms with different bedding types. Now, again, one of the limitations of the study is that even though we had 12 replicates, right, we went to these farms 12 times and collected samples so we could see a lot of what happened on that farm over the year, we really only have one representative farm with manure solids, one with paper fiber, one with recycled sand, etc. A lot of the other bedding research that has been done is more of a cross-sectional multiple farms with 1 or 2 samples. So we kind of took a different approach to looking at, you know, just a handful of farms many times. But again, we're limited in that we only had 1 manure solid herd. And this manure solid herd may not be representative of all manure solid herds. So our conclusions. We see a lot of variability in bedding. So all of that variability you saw even when we were trying really hard to sample the same way every time with the same person, because all these herds had about the same somatic cell, but we also know that there is some association. We expect to be some association between bedding and some of the smell quality, even though we haven't found that like magic number or magic thing. We also know that there's other things that affect our somatic cell: milking procedures, teat-end cleanliness, and teat-end condition, all those things. Because if you have very dirty bedding, but happen to do a great job in the parlor and have beautiful teat ends, that's a different story than very dirty bedding and horrible teat ends. And so I think that would affect each other. Sand was replaced weekly. So overall, when we did look at the bacteria counts, sand ultimately had the lower bacteria count, because even though it was similar, if we had sampled that farm one day after it was applied, like if we did it like we did manure solids or so forth, we probably would have lower count in sand, right? We sampled them when new bedding was due to be applied for them, which was a week later. When we did manure solids, we were applying it every day. Okay, and so I think I went over a few minutes, but that was the end of mine. Here's my email if you guys have any questions. And then at the end of this presentation, for those of you that will have access to it, this has the real numbers versus the log, so you can kind of see that the pictures aren't as pretty. So that's why I didn't include them there. But if you wanted to look at the bacteria counts, you can see them there. Okay, and that's it. Thank you.
Great. Thank you, Paula. So our third and final speaker is Dr. Pamela Ruegg. She is an endowed chair in antimicrobial resistance and a professor of large animal sciences at the College of Veterinary Medicine at Michigan State University. And we can see you, Pam, so thank you. And are you able to share your slides?
I will be able to share my slides. Let me get here. All right, first of all, I want to say it's fun to be meeting with people, but I agree with Paula, it is really weird to sit in your office and do these kind of talks. It is not nearly as fun as sitting in a room with people and seeing kind of the response and having that interaction. So that's a big downside on this. The other thing I want to say is 25 minutes for this subject is vastly insufficient. So this is kind of an appetizer on this subject, not the full course. So today I'm going to talk about maximizing the economic value of mastitis treatments overall. And I want to start off by showing you the picture of a cow. Just take a look at this cow. This is a real record on a cow from a real dairy comp record. So this cow is in 5th lactation. She is 407 days in milk. And here's her individual cow card. She calved in early September. She was bred, and then she had mastitis in January. She was treated. So this says high cell count. She got SpectraMast intramammary for 4 days. Then, so that was on the 12th. This is the second treatment, the third treatment, the fourth out of this first treatment. So this is all one treatment. Then she was defined as pregnant at the end of that month and then aborted. Then she had a second case of mastitis months later. She comes up pregnant again, they rebreed her. And she has mastitis again. It says high cell count, but that's their code, SpectraMast for 4 days. Comes out of the tank on the 16th, or goes back into the tank on the 16th. And then she has mastitis again about 6 weeks later in her right rear quarter. SpectraMast LC, 1, 2, 3 treatments, and then gets dried off. Okay, so here's a cow. You've had 1, 2, 3 episodes of mastitis. She's aborted. Okay, very long lactation. Good production in this particular cow. It's not on this particular cow card. So we got 3 cases. Here's her individual somatic cell count milk. Here's her total milk. It's 53,000 pounds. She's in 5th lactation. But take a look at the cell count on her. So you saw this first case of mastitis in January of 17. But this is what she calved with her somatic cell count. 728,000. 1.8 million, 1 million. Lowest it dropped at one point was 378,000. But typically this somatic cell count of this cow has been well over 500, 600, or even 1 million cells per mil. What do you do with this cow? Cow that aborted, 3 cases of clinical mastitis. Absolutely chronic cow. Absolutely the risk of curing this cow, pretty much zero with dry cow therapy. Is it worth using antimicrobials on this cow? Did this cow ever respond? The abnormal milk went away. Was it cost effective to use antimicrobials and discard milk on this cow? Those are some of the practical dilemmas we get into when we're looking at treatment of mastitis. And I'm going to address a few of these issues in our little appetizer talk today. So the objective today is to briefly review some of the practical concepts and economic impact of mastitis treatments. Here's the first response question I have. In the last year, how have you made decisions about treatments for non-severe cases of clinical mastitis? So select A if you based your treatment simply on your past experiences. B, if you use culture data from either on-farm or a vet clinic lab. C, you reviewed treatment records to determine effectiveness of treatments. D, if you used online searches for scientific data. E, if you just asked your friends. Or F, if you consulted with your veterinarian. So how have you made your decisions about how to treat? All right, we got a few answers going on there. Number one answer is I base my treatments on past experiences. Number two is and three are culture data or review treatment records. There's national surveys on this. And the national surveys show that I think it's something like 81% of producers base treatments simply on historical effectiveness with no definition of that. So it's our perception of what worked. The problem with that perception of what worked is what we're using to judge that as working. Just like that last cow that I showed you, milk went back to normal. The cow remained chronically infected for the entire lactation, was likely shedding bacteria in her milk and infecting other cows during milking. Long-term chronic infections. So your answers are very consistent with what national surveys show. We base our treatment decisions on past experiences, but I hate to say it, those past experiences aren't very useful for guiding the actual effectiveness of treatments. Let's talk a little bit about why it's important to think about how we treat mastitis on dairy farms. Paul started off, or Dr. Ostrum started off by talking about selective dry cow therapy, and he reinforced the importance of antimicrobial usage and how if we go to a selective dry cow therapy and only treat animals which are actually infected with pathogens that will respond to the treatment, we can reduce our antibiotic usage. The same thing applies to clinical mastitis treatments. Antibiotic usage on dairy farms is primarily associated with treatment and prevention of mastitis. I'm going to show you some data. This is total antimicrobial usage. That's what AMU stands for. In adult cows on 40 large Wisconsin dairy farms. We collected this data late in 2017, and the study is accepted for publication in Journal of Dairy Science any moment. On the vertical axis is the number of defined daily doses per cow per year of antibiotic. This is a metric that's used to measure antibiotic usage. One defined daily dose is 1 day of what the label says to use for treatment. So for example, if you had an intramammary tube that said give 1 tube a day, that's 1 defined daily dose. If you have another intramammary tube, like the Today product, for example, that says use 2 tubes per day, 2 tubes is 1 defined daily dose. So it's just a way to count up the amount of antibiotics used. On this horizontal axis, I simply have the 40 farms lined up from farm that uses least amount of antibiotics to those that use the most. So first I'm showing you the number of treatments for mastitis, the number of antibiotic treatments for mastitis across these 40 farms. The least using farm didn't use any antibiotics to treat for mastitis. The most using farms used 8 defined daily doses per cow per year to treat for mastitis. This is just treatments. This isn't dry cow therapy yet. Now we add on dry cow therapy. All of these farms used some antibiotic dry cow therapy. Most were using blanket dry cow therapy. So it's kind of a stable amount of doses that is used. And you can see that the least using farm for clinical mastitis still had 3 defined daily doses per cow per year. And in this instance, each tube given at dry cow therapy counted as 1 dose. And the most using farm had about 10 defined daily doses total. So this is the treatments for mastitis, both dry cow treatments and treatments using antibiotics for treatment of mastitis. Here's all the other diseases. That's the darkest bar is all the antibiotics used for all other diseases. And you'll see, with the exception of just a few farms here, the vast majority of antibiotics used on dairy farms is associated with mastitis. And then think back to that last question I just asked you, how do we decide to use antibiotics on farms? Well, we base it on our experience. And then you get into seeing the tremendous opportunity we have here of improving our antimicrobial stewardship on our farms. Because clearly, if we've got successful farms down here using 3 to 4 defined daily doses per cow per year, and we've got herds using 10 to 12 defined daily doses per cow per year, there's lots of opportunity for these cows to improve, or these herds to improve. So there's lots we can do to improve our antimicrobial stewardship, to reduce our antimicrobial usage, but to do that, we have to focus on improving our treatment of mastitis. Now, one of the first things we have to recognize when we're looking at clinical mastitis is the vast majority of clinical mastitis cases on dairy farms are not severe, the cow is not sick, and they're not caused by bacteria that require use of antibiotics. So let me just repeat that. Most clinical cases on most dairy farms are not a medical emergency. Cow isn't sick. Typically, she has either abnormal milk or symptoms localized to the udder, and they're not caused by bacteria that are responsive to antimicrobial therapy. Okay, here's some data that just to look at that, and then I'll show you how I've color-coded this pie chart. This is data from 622 cases of mastitis occurring on 52 Wisconsin dairy farms. This was a really simple study. We enrolled these 52 dairy farms. We simply asked them to send us milk samples from the next about 15 cases of clinical mastitis that occurred on their farm, and then to treat them however they wanted to treat them. And we didn't send them the results till months later. So we were trying to figure out what's causing mastitis and how are people treating it. And so what you'll see here is the majority of cases were either no growth or E. coli. And I've got those coded red because 85 to 90% of these no growths or E. coli do not benefit from antimicrobial usage. They're no growths. About 85% of the no growths are no growths because they've had a spontaneous clearance of the bacteria before we take the milk sample, before we detect the inflammation, that abnormal milk, the swollen quarter, the milk yield depression that is a result of that infection. They've already cleared, high rate of spontaneous clearance. E. coli, most E. coli cases, the cow doesn't get sick. And when you have a cow with E. coli that doesn't get sick, about 90 to 95% of those on most farms most of the time will result in spontaneous clearance. Now, I want to really stress, I'm not talking about sick cows here, when I say don't use antibiotics. If we've got a cow that's got a severe case where she's got a fever, she's sick, she's exhibiting pain or illness, those cows require immediate therapy. Talking about the most common types of mastitis. Now, another fraction of these were caused by environmental streps. We currently recommend the use of antibiotics for these environmental streps. I don't know how many of you have ever had strep throat, but if you don't have treat strep throat with antibiotics, you probably won't get rid of that strep throat. You'll stay sick. You'll get a fever. You'll be coughing a long time. I have actually experimented with this when I've had strep throat and tried to have a spontaneous cure and got sicker and sicker until I required considerable antibiotic therapy. So these I've coded green. We've got a variety of other pathogens that are occurring that don't have targets. We've got non-aureus staph and Klebsiella, which I've coded both green and a reddish pink, because some of those should have antibiotics and some don't need it. And then we've got all these other things like the Enterobacter that Paula mentioned, yeast, Enterococcus, Pasteurella, all of these things. The point I want you to make is the majority of cases of clinical mastitis on dairy farms either have a high rate of spontaneous cure or don't have targets for antibiotics. So we need to be culturing. We need to know the type of the pathogen in order to make the right decisions. All right, let's take a look at some more current data. In this study that we did in Wisconsin, where we enrolled 40 dairy herds, just a couple to measure the amount of antimicrobial usage, we also collected all of their dairy comp and computerized health records, and they were required to have good records in order to be enrolled in this study. So we ended up with data on treatments for more than 26,000 cases of clinical mastitis that occurred on 40 Wisconsin dairy farms in the year of 2017. These herds contained 53,000 cows. The treatments in general are shown here. 31% of these cases of clinical mastitis received no antibiotic therapy. That's a huge increase over 10 years ago. So in many of these herds, they've listened to what we've learned about cases that don't benefit, and they've applied it. So 31% of those cases received no antibiotics. 53% of the cases received Spectromast LC for an average of 5.7 days. 10% got Today for 3 days. Pursuant Amoximast were used on 3% of the cases for between 4 and 5 days. And then the Hedison K and Dairy Clocks, less than 1% of the cases for almost 6 days. And 14% of the cases received injectable antibiotics. So when you look at this across all the farms, the vertical axis on this chart is the proportion of total adult cows in the herd that had mastitis and either did not receive antimicrobial therapy or received antimicrobial therapy. So what I want to point out here is, look at the huge variation between herds. This particular herd right here had lots of cases of clinical mastitis, but the majority of them didn't get any antibiotics at all. This herd right here, all of the cows that got mastitis received antibiotics. This particular herd right here, about half of the cases that got mastitis received antibiotics. Lots of variation in how we're treating mastitis. But overall, about a third of the cases today in Wisconsin on our large herds aren't using antibiotic therapy. Well, why does it matter how we treat mastitis? Well, it matters because we're trying to improve our antimicrobial stewardship, use antibiotics responsibly, but it also matters to the economic situation on the farm. One of the other things we did with these 40 farms, where we had all this data, these 26,000 cases, is we took a look at the costs of those treatments on farms. And so we went in and looked at just direct costs. We didn't put any costs in for labor or culling or death or any of those things. These are just the direct costs of treatment. And for these 40 herds, the average was $147 per case. That was distributed as $24 for intramammary antibiotics, $15 on average for injectable antibiotics. And the key that I want to mention here is $109 for milk discard. So 75% of the cost, the direct cost of mastitis treatment on dairy farms is milk discard. Why does that matter? It matters because the thing that drives the days of milk discard is the number of days that you treat. The more days you treat, the longer the days of your milk discard. So when you make a decision to treat beyond what the label recommendation is, or if you make a decision to use the longest duration on the label, you're making a decision to maybe double the cost per case or cost of your treatment per case. And one important thing to recognize is there's only a few cases and pathogens where that extended duration, each additional day of therapy, may benefit and result in higher bacteriological clearance rates. You can see that the impact of this on each farm. In this instance, we got each of these 40 farms lined up across here. And what you'll see is the cost per case per farm. The lowest cost farm was under $100. That's the farm that didn't use any antibiotics at all. But that wasn't much different than the other farms that used some intramammary antibiotics. And then the highest cost farm was more than double the lowest cost farms. The red bar is the cost of injectable antibiotics, and why that averaged out at $15 per case. There were less than a third of the farms that actually used injectable antibiotics to treat cows. So very important to be critically evaluating your duration of treatment and whether or not every extra day you add brings you any value. As I said today, this is just an appetizer course today on treatment. And I want to refer you to a much longer article that I've written about how to treat mastitis called Practical Approaches to Mastitis Therapy on Large Herds. And it steps through kind of the protocols for an effective mastitis therapy program. We'd like to have our intramammary antibiotics used on gram-positive cases. We want to reserve injectable therapy for only sick cows. We want to make sure we review the somatic cell count and health history of the cow before using antibiotics. We want to have protocols in place, written, standardized protocols for treatment. And those protocols should, for the most part, follow the label guidelines for the drugs that are being used. And if we're treating Staph aureus, or if we have Staph aureus, I should say, on the farm, only a few cases of those should be treated. The rest of those cases, the effectiveness of antibiotic therapy for treatment of Staph aureus is very, very low. So only a few of those cases should be treated. The other cases should be culled, quarters dried off, and the cows segregated. And if you do not have the opportunity to use on-farm culture with selective treatment of clinical mastitis, if you're treating everything without knowing what the pathogen is, you want to use short duration intramammary therapy. Follow the labels and use short duration. So how do we apply this on farms? We want to use antibiotics only for cases that will benefit, not on every case, only on cows that will respond, not on that cow like that first cow I showed you that had months and months and months of high cell count, and for as short as possible to achieve bacteriological clearance. To do this, we got to make sure we do severity scoring. I'm sure you're all familiar about this, but either a numerical score of 1, 2, or 3, or a written score of mild, moderate, or severe. But basically, we're differentiating cows with only abnormal milk or abnormal milk and swollen quarters, the non-severe cases, from those that are severe. And with these non-severe clinical cases, in the best case scenario, we're using rapid culturing to to decide when to use antibiotics, but if we're not using rapid culturing, we're going to use a short duration intramammary therapy. Before we make any decision about treatment using an antibiotic on a cow with mastitis, we want to review the somatic cell count records. Because that information about how long the somatic cell count has been high helps us guess at the type of the bacteria that's causing the infection. So even if we're not culturing, if we're not able to do on-farm culturing or culturing at a local vet clinic, if we take a look at the cell count history, we get some clues that can help us make some decisions. And that's because gram-positive infections, those are things like staph and streptococci, they usually have a long period of a subclinical infection before they have a clinical case. And in those instances, we may want to use antibiotics, because if we've seen a cell count high for a while, we know that the spontaneous clearance rate has been low. Now, on the other hand, we can also take a look at the cows and see that they've had a high somatic cell count for their entire lactation. And maybe the cows had antibiotics a couple times. And we take a look at that and say, wow, those antibiotics didn't work. The milk went back to normal, but she remained subclinically infected. I don't think I'll use antibiotics on her again. For gram-negative infections, they usually don't have a high cell count for a long period. Now, that's not always true for Klebsiella, but E. coli typically have maybe one test or not even a test above 200,000 before they go clinical. And so in most instances, if we see a cow with a mild clinical case with a low cell count before it, many of those cases don't require the use of any antibiotics at all. So that's another clue we can put in place. All right, I see my time is ticking away here, so I'm gonna try to move along fast. I want to point out, I get a lot of questions about what intramammary products to use and are there differences amongst them. Here's the 7 intramammary drugs that are available in the US. We've got amoxicillin, ampicillin, cloxacillin, penicillin, perlamycin, ceftiofur, and cefaprin. You remember these 2 are the most commonly used. Gram-positive activity is the most important thing to look at because we use antibiotics routinely for treatment of gram-positives. For most gram-negatives that aren't sick, we don't need to use antibiotics. And what I want to point out is, for most of the drugs we have available, the gram-positive activity is the same. There's no studies that I am aware of that have shown for treatment of gram-positive mastitis any differences in outcomes among the commercially available products that we have in the US. So it's not the drug that's making the difference on these. It's probably the cow that's making the difference. There are differences in the duration of treatment. So these are the label dosing on the bottom, ranging from 3 tubes at 12-hour intervals down to a daily tube a day for up to 8 days. But remember, that decision to go with a longer duration, a 5-day treatment or an 8-day treatment, will really push your costs up. So if you make that decision as a standard treatment, you're going to be one of the more expensive herds if we do benchmarking on costs. So here's an important take-home point. There's few differences in the spectrum of activity among approved drugs in the US. And there's no studies have demonstrated improvements in outcomes for most type of mastitis based on use of different drugs. So make your decision on drug based on other decisions or other characteristics. I'm going to skip this response question. I'm going to move right on. Want to just spend a minute talking about duration. Here's another real cow. This is cow 4888. She's got a relative value of 112. She's got a ME305 of 33,160 pounds. But let's take a look at this cow. Mastitis, 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 mastitis. If you count these up, she's got 11 mastitis events. Now this cow has a days in milk of 497 days. But if you take a hard look at her data, she only milked 342 of those 497 days because she had 55 days where she was receiving antibiotics and she had 66 days where her milk was being withheld. If you took a look at that 52,000 pounds of milk she produced and divide it by 497, she averaged 106 pounds per day. But if you take a look at the 38,000 pounds that she produced on the days you could actually sell her milk, she only produced 78 pounds per day. Really costly to keep chronic cows around. And here's some data. I took a look at the 2017 Northeast Farm Credit data. The net income per cow in 2017 was $291. Here's a study we published in 2011 looking at the expected monetary value per mastitis case, and you can call this loss. So if you treat for 2 days, you're going to lose about $260. If you treat for 5 days, you're going to lose about $315. If you treat for 8 days, you're going to lose about $360. Remember, all mastitis treatments are losses. You're just trying to minimize loss with your therapies. All investments in prevention are investments. You're trying to make more money by limiting losses. If you look at the average cost of mastitis in our study, it was $323 US per case, which exceeds the net income per cow, and it's driven by duration. This is the second take-home point. Extended duration of therapy is almost never cost-effective as a standard therapy. I just want to say it's okay for some cows on an individual cow basis, but in general, we have no data to suggest we shouldn't use the products in any way other than that on the label. All right, so which cows should be treated and when are antibiotics helpful? Well, remember, when we're giving antibiotics, the value of them is to enhance and speed up bacteriological clearance of this mastitis infection. That means that the case must be a treatable case, meaning it has to be caused by a type of bacteria that the available antibiotics can actually treat, and it has to be occurring in a cow that doesn't have other issues that reduce the probability of cure. And when we use the antibiotics, you have to remember that the benefit of the antibiotics we're giving is only in excess of the expected spontaneous cure. So I want to talk a little bit about spontaneous cure. That means the cow's ability to eliminate an infection without any antibiotics, and it varies by pathogen. The least expectation for spontaneous cure is probably Staph aureus. Only about 10% of those cases probably spontaneously cure on average. That means if you had a perfect antibiotic, you could improve 90% of them. There's huge value if you had a perfect antibiotic in a treatable cow. In contrast, let's look at E. coli. Spontaneous cure rate for most E. coli is about 95%. That means the antibiotics you're given are only going to be able to impact about 5% of the cases. So in general, you need to know the type of pathogen that's causing mastitis to know if antibiotics will be useful. So we need to have a case that can be treated, and we need to have a cow that'll respond. So we want to look at the history of the cow before treatment. And antibiotics are rarely useful for cows that have a previous diagnosis of Staph aureus, Mycoplasma, Prototheca, or Klebsiella. Cows that are chronic, meaning they've had more than two previous treatments of clinical mastitis in the same quarter. Cows that have multiple quarters affected. Cows that have more than 4 months of high cell count, or cows that have had chronic clinical or subclinical mastitis in previous lactations. So my final take-home point is extended duration of therapy won't help these cows. Changing antibiotics won't help these cows. Changing careers will. These cows need to be segregated and culled. We don't want to waste antibiotics on them. All right, so what are our recommended options? If you're treating mastitis or not treating mastitis using an antibiotic, managing the case in a non-antimicrobial fashion, become concerned if the milk is abnormal more than 7 days, if the cell count remains high, greater than 21 days, or the cow does not return to milk. Those are our best outcome indicators. Your interventions should be, if you're concerned, culture the milk and use the results and cow characteristics to discuss and decide options. If your diagnosis is unknown, make sure you take a look at the cow characteristics. And always, when we're considering treatment, think about the non-antibiotic options. No treatment and segregation, quarter milker, dry off the quarter, or cull the cow. So here's the take-home message. Mastitis is caused by diverse pathogens. 30 to 50% are culture negative. Probably on most farms, no more than a third will benefit from antimicrobial therapy. Our challenge is we can't tell who those third are unless we culture the milk. Days of abnormal milk should not be used to guide treatment. Changing among approved intramammary antibiotics will rarely improve outcomes. The spectrum's the same of most of these antibiotics. Extended duration of treatment is very costly and it will only be recommended for a few pathogens or a few specific cows. And our cow characteristics and identity of the pathogen are the most important characteristics that we can use to help decide what kind of therapies to use. So with that, I will conclude. And it looks like there's a chat question. What do you suggest for organic farms to use as treatment? I actually studied this. Inta Shukin and I, when he was at Cornell, had a study. We had 300 dairy farms enrolled. We looked at how treatments were done. The person putting this chat in said, I can't find any science to support any of the claims like garlic, lavender, and lemon. Absolutely 100 correct. There is no science on these. Organic farms can't use antibiotics. There are no known non-antibiotic therapies which are effective. What I recommend on organic farms is know what your pathogen is and know what the spontaneous cure rate is, and then manage those cases that you don't have a high expectation for spontaneous cure using one of the non-antimicrobial alternatives that we just discussed. All right, that's the appetizer.
Thank you, Pam. So if Doctors Pete and Paula also want to unmute, and then the three of you can stay unmuted, and we'll just work through some of the questions that we already have in the chat, and then I will ask for others to unmute if they want to ask a question. So just going back up to the beginning, I think this was during Pete's presentation. The question was, if a farm has a low bulk tank somatic cell, they do monthly tests, but they do not routinely culture clinical mastitis cases. Do you think they would still be a good candidate for selective dry cow treatment?
They certainly could be. Based on the algorithm criteria, they could be. As long as they are recording their clinical mastitis events. But individual cell count data will give you more information when using the algorithm. So bulk tank data alone won't give you the full answer for using the algorithm.
Okay, and then I believe this was also for you. You said there was some antibiotic savings, but how significant were the extra labor costs with selective dry cow?
Again, I don't have a dollar value. Pam might actually have a better dollar value on that, but certainly time not treating those cows with antibiotics. But remember, most of the herds that are doing this are still giving internal teat sealant. So, the time savings is probably, not that great, because again, they were looking at every cow, handling every cow with an internal teat sealant, being extremely careful when they did that.
And then was there any reason the study did not have no dry cow treatment as a control group?
Again, it was probably because most people are using blanket dry cow therapy. That's been, the common recommendation for years and years. That's really what they wanted to look at now. And I'm sure studies have been done on that, but that was not this particular, part of the study.
Okay, and then this might be for Paula, I'm not sure, Pete or Paula. For the culture, there is a time frame for results. Could that cow not get an infection in the time that you're waiting for the results? And then if so, would you do mastitis test prior to dry off?
So when they were doing the culture-based quarter treatment, we had results back within 24 to 48 hours of when those cultures were taken. So really, yes, there's a possibility that she could culture negative and have a clinical mastitis event or become infected from the time you took the culture to the time that you dry treated her. But we had results back, extremely quickly.
And then this, I'm assuming, is going to touch on some management factors as well. So the three of you feel free to jump in. The question is, as a result of selective treatments, we have a proportion of cases of cows getting mastitis in the dry period. What can we do to combat this? Thinking changes to dry cow management.
In my opinion, my experience, cow cleanliness is key. One, if they're using internal teat sealants, they've got to be, without antibiotics, they have to be meticulous in their technique. And then really, how are those cows housed? No overcrowding. Bedding is got to be spotless for those dry cows. And again, well-fed, make sure that the nutritional plane is where it needs to be. And you'll probably, the others can comment, but you got to check all the boxes for your dry cows and pre-fresh cows.
Yeah, nothing much to add there, except as we noted from the bedding stuff, drier bedding means less bacteria, and dry bedding happens when you have enough stalls per cows and not overcrowding, especially in the dry group, which doesn't get cleaned as often as lactating pens. So being dry and being clean, it's going to help lower the environmental load.
Okay, a couple more from the chat and then we'll open it up. This is a question for Pam. When we suggest a treatment for strep uberis, is it correct to suggest a product allowed for long treatment, not only 1 or 2 tubes?
That's a great question. I really don't know. I have recommended that myself based on some really old data. I just wrote a review article looking at 20 years of clinical mastitis research, and I don't think we know the answer to that. I have a study we're just analyzing right now where we varied duration of treatment of streps. And I might have an answer to that in about 4 or 5 months.
And then I believe this was a question from Paula asking, is there a better dry off antibiotic product for herds with high levels of Staph aureus?
I've had this question and I don't know, so I thought I'd put it out.
No, the answer is no. I am not aware of any variation. I think that if you look at Staph aureus overall, the number one factor that will determine bacteriological clearance rates is the presence of beta-lactamase or not. If you happen to have a beta-lactamase negative Staph aureus, and you can test for this, your cure rates are going to be quite high. If you have beta-lactamase positive, your cure rates are going to be quite low. So, you know, other than that, the cure rates, the real cure rates are almost universally low.
Okay.
There's one more question, but it was from Casey. So I'm just going to wait and see if there's any participants out there that have an additional question or comment for any of our three speakers. Feel free to unmute yourself and speak up. And we'll just give them a minute to do so. And if not, then I'll ask that question from Casey.
So I think another one popped up about not treating for mastitis. Right under Casey's question, another one popped up.
Sure, we'll do that one.
I see that question, but I don't understand it.
Yeah.
Our farm does not treat mastitis. We treat symptoms, so no quarter treatment. Should we look into quarter treating?
So maybe they're treating like sick cow stuff, like the cow, not the quarter.
The answer to that question is probably you should do some culturing and figure out what your pathogens are. And that's a really boring answer that I give repeatedly, but it's the reality. You know, it's just like we've been in this pandemic now for almost a year. And, you know, you get a cough and you're wondering, do I have a normal cough, the cold? Do I have the flu, or do I actually have COVID? And depending on which of those you have, the symptoms may be all the same, but the way you'd handle it are very different. And mastitis is very similar to that. The pathogens do matter. And so if you're not treating, you really should figure out what your pathogens are so you know if you should or not.
Okay. Did anybody want to be brave and speak up and ask their question? All right, we'll give you one last chance after this last question from Casey. So for Paula, the question was asked about using limestone. I don't believe you talked about the use of lime in your presentation, but I could be wrong. But do you want to touch on that?
Yeah, we didn't have any farms specifically using it in our research that I presented, but generally anything bedding wise, the recommendation is you have to look at how the udder is in the skin of the udder is reacting to whatever bedding that you're using. So on some farms, different projects and so forth that we've been seeing a really dry skin associated with it. So the recommendation is it depends on that, and keeping an eye on that will matter, because even though it does help kill bacteria, it raises the pH. And so, but if you counteract the bacteria kill in the, in the environment by making the skin so dry that now the cow doesn't have its own protective mechanism, just because the skin is cracking and so forth, then, you're trading one problem for another. So, yes, people use it, and yes, I think it's a good idea, but you have to really monitor cow skin condition when you do.
Okay, we're at 2 o'clock, so any questions out there that haven't been answered? Now's your last chance.
So I do have a question. Is there a possibility that there might be interactions between certain tea dipping products and bedding with some lime products? Years ago, I remember walking on a farm and the guy was having all sorts of problems, and I'm standing there watching him dip teats, and I just happened to go in the milk house and was reading the label. It was a long time ago, but could that still be a case?
So a reaction between the dip and the lime?
Yes.
Okay. I don't know. Do you remember, was it iodine based dip or something?
No, I just remember it being blue.
Okay. Yeah, I don't know, maybe Pam or Paul.
I'll jump in. Yes.
Okay.
I've definitely seen that. I think there's also more complicating factors in the degree of moisture in that bedding. Paula has mentioned the moisture content of the bedding. That can have tremendous impact. I had a herd that I worked with within the last few years that had manure solids that were really wet, and they used a peracetic acid spray in a big rotary parlor, and some other issues along with the vacuum levels and such. But they developed these tremendous ulcers on their teats. They also had limestone that they were using, and I think there was a combination of those factors overall that resulted in really some detrimental impacts on the teat skin. So I think those are things that are really important to keep in mind when you start seeing problems with teat skin, either dry or wet or ulcers or whatever.
So I have one more question. We were talking about organic, and Pam, you mentioned something about the use, going through everything, and then the use of the things that were mentioned in the question.
Mhm.
I'm struggling with this. I have organic farms I work with, and I'm just trying to figure out how to help them out more. And I also I get really antsy because I have listened to people discuss infusing certain things into quarters, and the discussion doesn't even talk about how clean you should be or the aseptic methods that you should use to do so. It makes me cringe.
So one thing that was really interesting when we did this survey, again, we had 296 farms in the study. Out of those 296, about 200 were organic and about 100 were matched herd size conventional farms in the same basic vicinity as the organic. And we collected all their treatment data. It was a massive study, lots of papers that came out of it. And one of the interesting things about treatment of mastitis was on our organic farms is there's an enormous variety of substances used. So I won't even get into the data, but I will say there is no data anywhere in the world that shows that any of these substances have efficacy, but I won't even get into that. But I would say that I think farmers are smart enough that if one of these numerous substances that people are using to treat mastitis was effective, they would all use it. But what we found was huge variety. And so first of all, none of those products work. Second of all, it's very difficult to tell if those substances work anyways on farm without a controlled trial, because milk goes back to normal in 5 to 7 days, regardless of bacteriological clearance in the vast majority of cases. So the inflammation subsides. And then thirdly, infusion of any substance into the udder of a cow in an attempt to treat is not allowed under FDA regulations. So in any instance, no infusion should be done into quarters of cows of non-approved products.
Thank you.
Okay, awesome. Thank you so much, Pete, Paul, and Pam. And thank you everybody for joining us today. Casey has posted in the chat box once more a link to the online survey just to give us some feedback from today. And participants of Dairy Day will be receiving an email link to a box folder with proceedings. And we will be sharing recordings on YouTube for the speakers that have approved that. So look for those things to come in the future. And with that, again, thank you to everyone for coming. Thank you to our speakers, and thank you again to our sponsors for helping us make this successful and be able to offer it for free to producers. So thanks again, and hope everyone has a good day.